All right, so let's pick up with the muscles of the trunk and the pelvic floor. So the muscles of the trunk are the muscles grouped together by anatomical proximity, function, or both. Those ones that are to the outside. Muscles of respiration, the diaphragm, the internal intercostal muscles, the external intercostal muscles. Again, here's the diaphragm showing a an inferior surface of the diaphragm. Here's the external intercostal muscles, the internal intercostal muscles. All of these muscles are designed to work in concert to increase the size of the thoracic cage where the lungs are found to enable breathing. These are the muscles of breathing. Again, the diaphragm flattens the floor, it compresses down. These expand outward and relax inward. The abdominal muscles, such as the rectus abdominis, the external obliques, the internal obliques, and the transverse abdominis. The rectus abdominis lies within connective tissue covering called the rectus sheath. The linea alba is a line of connective tissue in the abdominal midline that's put up here. Separates the left and right abdominal rectus muscles. And again, here's a cadaver photo showing there's the rectus sheath attaching the rectus abdominis muscle. There's the rectus abdominis. There's the linea alba, and there's the navel protruding through the linea alba. Transverse abdominis, the external oblique, that's the internal oblique, there's the external oblique. Again, some of these muscles, you have to cut one muscle out of the way to get to the other muscle, showing this is the most superior muscle, this is the most inferior muscle of those muscles that are on the side along this area of your body here. Again, there's a side view of each of the muscles. There's the transverse abdominis, overlaid by the internal oblique, overlaid by the external oblique, and there's the rectus abdominis running up and down the front. Again, these muscles allow our torso to do all sorts of things, to bend forward, backwards, left and right, laterally flexes and compresses the abdominal cavity. Here is a pelvic floor muscle. Again, this is a posterior, there's the posterior, the anterior, and we are looking down on this portion of the body as if, aliens came and cut me in half and we're looking down at my body. There is again, the symphysis pubis, hold those bones together. We talked about that. We talked about the os nose bone. Again, you see the coccyx and the sacrum, a lot of muscle attachment going on those areas. There's several of the muscles, the pubosagasis, the iliosagasis, coccygesis, the ischiococcygesis, the urethrogenetal diaphragm, there's the urethra, the vagina, so this clearly the female. I was going to ask you in a minute if you could tell whether this was based on your knowledge of skeletal system, whether we could tell whether or not this was a male or female pelvis, but this is a dead giveaway here. So we're clearly looking at female. Think about it. What are the characteristics of the pelvic girdle that tell us that it's a female? The Jeopardy, I will hum the Jeopardy thing. The more rounded shape is one of the characteristics. Yeah. Okay, the urogenital diaphragm transmits the urethra, both male and female, and the vagina, female, through the pelvic cavity to the perineum. The external urethral sphincter is under voluntary control of urination. That's the one that you hope is in really good shape when you're driving down the interstate and you get that urge, oh my goodness, I should not have drank the Route 44 sweet tea. And the next exit is, oh great, 14 miles. You hope that muscle is in really good shape. The deep transverse perineal, and superficial transverse perineal muscles, they support the pelvic cavity or the pelvic region. The external anal sphincter, again, voluntary control of defecation. That's the one your hope's in really good shape. But again, in addition to the Route 44 Diet Coke, probably shouldn't have had, the 2 orders of mozzarella sticks and onion rings from Sonic when you knew you were fixing to get on a 4-hour car trip. Controls defecation. You hope those muscles are in good shape. And there they are in cross section, showing where they are and the differences here. Look at the difference between male and female. Check out perineal muscle on the female as opposed to perineal muscle on the male. That's the muscle here and the muscle here. Again, you see that much more broader opening in the pelvis than in the male. Why do we need that much broader open for females? Again, the Jeopardy thing. As I take a drink to try to prevent my throat from scratching, child butt is the answer. Muscles of the perineum, the bulbospongiosus, and the ischiocavernosus muscles. They're found in the perineum. And that's between the upper thighs where both males and female genitalia reside. So it's this area right here. Again, there's the gluteus maximus. That's your butt muscle. But again, here's the ischio-cavernous, the bulbo-cavernous, and see both males and females have them. They're just positioned and constructed, a little bit different. And again, here's those muscles of the pelvic diaphragm, the urogenital diaphragm, and the perineum with their actions and insertions, origin, insertions, and principal actions. Pelvic floor exercises or Kegel exercises strengthen several pelvic floor muscles, especially the pubococcygeus, by slowly contracting and relaxing. These help to strengthen the sphincter muscles, decreases incontinence, guards against pelvic organ prolapse. Weak muscles allow pelvic organs to slip out of place. Some folks that suffer from pelvic organ prolapse literally have to have surgery to go in and pull those organs back in place to where they're supposed to be, and then sort of tack them or stitch them to structures so they stay where they're supposed to be. Risk factors: childbirth stretches and traumatizes muscles, and the more children you have, the more likely this is to happen. Age, weight gain, and hormonal changes such as menopause or light menopause in females, changes in prostate gland and other reproductive structures in males. But again, these Kegel exercises, that's one of the first things many doctors will try with folks who start to suffer some incontinence. You sneeze and you pee a little bit, you laugh and you pee a little bit. You get those. You can learn these Kegel exercises to help strengthen those muscles. Muscles of the pectoral girdle and upward limbs. Let's stop here and let's have another short little break, and then we can have another video. Thank you.